Welcome to All Around Health Talk with your girl, Dr. Onyinye. I'm so excited. It's 2025, and I just want to say Happy New Year. And I hope that this year brings you all the prosperity you desire. And I hope it's a year filled with answers to all your prayers. Now, like you know, we ended last year talking about pregnancy, what to expect when you're expecting. So obviously, this year we're continuing with our pregnancy series. Now, if you plan to get pregnant in this year 2025, hurry, run and go and watch my last two videos on pregnancy. You're going to find a video on what you should do to prepare to get pregnant and what you should do in your first trimester. Today, however, we're going to be talking about what to expect in your second trimester. All right. But before we talk about that, if you have not subscribed to my channel yet, it's 2025. Stop wasting your time. Go ahead and subscribe to this channel, join our family, and continue to receive health content that will impact your life positively. Don't forget to put on your notifications so that you also get notified for every time I post a video. Now, let's get right into it. Second trimester. I feel like second trimester is a relief for most women because the nausea is gone. Most of those early symptoms that were so annoying are gone. And this feels like an easier trimester. However, it comes with its own symptoms. So we're going to talk about what to expect in the mother during the second trimester, what to expect in the baby, the fetus that is growing inside you, and what to expect from your doctors. So second trimester starts from the 14th week of pregnancy all the way to 26 weeks plus 6 days. Now, talk about the mother. What will you as a pregnant woman experience in your second trimester? One thing you're going to experience in your second trimester are nasal congestions. Now, because of the increased blood flow during pregnancy, your mucous membrane will also receive increased quantity of blood, causing you to have nasal congestion and even nosebleeds. So you want to make sure that you're hydrating properly, and you can use over-the-counter medications that are safe during pregnancy to control your nasal congestion. Now, you're also going to experience mild swelling of your ankles and feet that will go through till the third trimester and should disappear after pregnancy. Now, this mild swelling in the ankles and feet will occur in 3 out of every 4 pregnant women. Another thing that you will experience will be sensitive gums. Now, your gums will be very sensitive and you might tend to bleed easily from your gums. Also, if in your first trimester you had a lot of vomiting, right, morning sickness, then that might also damage your dentition. So you want to make sure that your dental care is top notch during this period of pregnancy. You're also going to experience leg cramps, especially in your calves of your legs. So what you just need to do is make sure that you're stretching, make sure that when you're sitting down, you have your legs raised, make sure you're not standing or sitting for a very long time. Another thing you would see during the second trimester is dizziness. Now, dizziness mostly because sometimes your blood pressure drops, or because as your uterus and your baby grows, it begins to compress your vena cava. Because of that, you might have dizziness. Now, what you want to do during this time is make sure that you take your time to move from a sitting position to a standing position. Avoid standing for too long. Make sure that you're active. Make sure you're hydrating properly, and make sure that you're eating in small quantities but in a healthy way. Now, another thing that we will expect in the second trimester is lower abdominal ache and even Braxton Hicks contraction. Now, you will have lower abdominal ache because now your uterus is growing and it's pulling on your abdominal ligaments, so you can feel aches here and there. Also, you might start feeling some tightness in your uterus that feels like a contraction, but they will last for less than a minute, and they're mostly Braxton Hicks. They're false contractions, but if you find that these contractions last for a long time, please talk to your doctor. Another thing to expect is varicose veins or hemorrhoids. Now, because your circulation is increasing to supply blood both to your body and to your baby, then your veins might also tend to enlarge, causing varicose veins to appear on your legs, or even causing you to have hemorrhoids in your anus. But all of these things will disappear after the third trimester once the baby comes. Obviously, we're going to expect some weight gain. Now, this second trimester, your appetite is better, so weight gain is going to be more than the first trimester. Actually, a woman in her second trimester will increase 0.5 to 1 pound every week. And we're talking about 14 weeks of the second trimester. So you should be expecting to gain roughly about 14 pounds by the end of your second trimester. So make sure to try to stay healthy. Your skin is going to change. A lot of women tend to glow while they're pregnant. That's because of all the hormonal production. So you're going to have your glow, your pregnancy glow. But also, melanin production will increase. So you're going to start seeing brown patches on your face. And this is what we call melasma. And you also see like a black line in the midline of your abdomen. We call that the linea nigra in medicine. All right. You also tend to see stretch marks around your thighs, around your buttocks. All of that is part of the process because your uterus is stretching out, your whole body is stretching to accommodate your uterus. Now, the sunlight is not your best friend during this time since your melanin production is increased. Try to avoid sunlight, especially between 10 a.m. and 2 p.m. Use sunscreen so that this pigmentation doesn't intensify, but they will reduce in intensity or disappear after you deliver your child. Another thing that you might notice is vaginal secretions. Now, you might notice that you're producing more white, sticky vaginal secretions or discharge. It's normal. But if your discharge begins to smell bad, begins to look yellowish green, then you want to make sure you see your doctor. Also, urinary infection is high during this period of pregnancy. So you want to make sure that if you feel any burning sensation while peeing, you need to see your doctor. Now, you're also going to feel your baby's kick in this second trimester because your baby begins to move a lot and you can feel those little kicks or flutters in your abdomen. Other things that you might notice in second trimester is headaches, forgetfulness, mood swing, hair growth. Hair might start growing in places you've never had them before. So if you're a woman who has never had chin hair growth, you might start noticing that. It's all part of the package, but after pregnancy, all of those should disappear or at least reduce. So as a woman, that's what you should expect in your body during the second trimester. Now, what's happening with your baby during the second trimester? As you are adding weight during your second trimester, your baby is also adding weight because your baby is growing. So by the end of your second trimester, you should be carrying a fetus that weighs about 2 to 3 pounds. Another thing that is very important that happens to your baby in this trimester is movement. Your baby begins to move, starts kicking, starts jabbing at you. So sometimes you'll feel those little kicks. Your baby is beginning to flex his or her muscles. All right. Now, there's also development of hair, skin, and nails. Your baby is going to start having nails on their toes and fingers. Their skin is also going to begin to change, right? Their skin will be covered with very fine hair that is called lanugo, and also some greasy, oily protection that will cover them. That is called the vernix caseosa. All of that is to keep your baby warm and protect them while they're in your womb. Another thing is they're also going to start having little hairs on their heads. So that's a beautiful process happening there with your baby. Your baby's digestive system will be very, very developed. They'll start swallowing and even sucking their tongue. And so as they continue to swallow, studies even show that they can begin to get a sense of taste of the foods that you're eating, which can influence the kind of food your baby likes once your baby is born. So try to eat healthy so that your baby can taste healthy stuff and have a taste bud for healthy stuff when the baby comes out. Ears and eyes are going to appear in their right position. Actually, the baby is going to start having eyelids and eyebrows, and the baby can even begin to open and close their eyes. Their ears are going to be developed. So at this time, if you want to talk to your baby, go ahead and talk to your baby because they can begin to hear you in the second trimester. And also, they also get a sense of smell during this period. And last but not the least, their little heart is pumping very well, and your doctor can actually hear the heartbeat of your child by using just a stethoscope. So your baby is flourishing and growing in this second trimester. And because you and your baby are both flourishing and developing and expanding, there's so many things that your doctor would want to do in this second trimester that are very important. Number one, you have to go for your routine check during the second trimester, and during this routine check, your doctor will check your weight to make sure that you're gaining weight the way you should. Is going to check your blood pressure, is going to check the size of your uterus to make sure that it's in accordance to the number of weeks of pregnancy that you have, and is also going to listen to the fetal heartbeat. So you're going to be hearing a lot of your baby's heartbeat during this period. Also, your doctor will want to do an ultrasound. This ultrasound basically is to look at the anatomy of your baby, see how your baby is growing, the height, see if you have enough amniotic fluid, and all of that. It's basically to check on how your baby is growing and flourishing within you. In this second trimester, it's also very important to do a glucose screening between 24 and 28 weeks of pregnancy, especially because 1 in 10 pregnant women end up with gestational diabetes. So your doctor will do a glucose screening just to make sure that you don't have gestational diabetes, and if you do have, then they will start treatment immediately. Another thing that your doctor will do in the second trimester is genetic screening, right? Because there are risks. If you have risk based on age and other factors of having a child with a genetic disorder, then your doctor will do a blood test to determine genetic problems or chromosomal abnormalities. The doctor might recommend an amniocentesis, where the doctor extracts some of your amniotic fluid to study it for genetic diseases. Okay, and also your doctor will recommend that you get vaccinated, especially if it's during the flu season. You will need to get your flu shot. And one more thing your doctor is going to recommend is that you start sleeping on your side, because as your uterus expands, if you sleep on your back, it compresses your vena cava, which is the blood vessel that helps blood return all the way back to the heart. So now your doctor is going to ask you to lay on your side to avoid compressing that blood vessel. Also, you would have to do exercises that do not require you to be flat on your back. So during this time, you want to make sure that you're eating healthy, you're doing second trimester friendly exercises, dieting, and remaining active. Keep your body active so that your body also is able to adapt to all the changes happening. So if you have enjoyed this video, go ahead and hit the subscribe button. Subscribe and get notified every time I post a video. Give me a thumbs up if you like what I'm doing. That encourages me to make more content. Go ahead and share this video to a friend who is currently pregnant or preparing to get pregnant. And if you have any question or a comment, leave it in the comment section and I'll see you there. Thank you and bye.